Welcome to the Cardinal News of Virginia, a podcast from Cardinal News. We are a nonprofit news outlet. We cover Southwest and Southside Virginia at cardinalnews.org. The Cardinal podcast is sponsored by 5 Points Creative, a full-service award-winning marketing firm serving clients all over the U.S. from their headquarters in Roanoke, Virginia. I'm Dutchie Jessee with Cardinal News, and today I am speaking with Elizabeth Beyer. She covers state policy and government for us from Richmond. Hi, Elizabeth.
Hey, Dutchie. Thanks for having me.
Yeah, thank you for sitting down. So I'm just going to start with the headline of this piece you wrote, A Perfect Storm for Fire and EMS Departments. Costs and calls increase while personnel drops and funding remains stagnant. That is kind of a yikes situation. So really comprehensive article that you wrote several weeks back. And I want to talk about it a little bit more in depth in the podcast today. There is a plethora of factors affecting this whole issue, and your article gets into it, so we'll talk about it. Fire and EMS departments, volunteer fire and EMS rescue squads are largely volunteer, especially in Cardinal's coverage area, because we are Southwest and Southside Virginia. We have lots of rural pockets. So I want to start by just defining the article you wrote. Were you referring to just volunteer squads or a combination of paid and volunteer? Can you lay that out for us?
So mostly volunteer. That is where the issue mainly lies. And something that I hadn't learned I hadn't known prior to this article was that I think about 70% of the fire and EMT services in Virginia are volunteer because, Virginia, there's a lot of landmass, there's a lot of rural, there's a lot of mountains, there's a lot of rural populations and spread out populations. And, you typically find paid and career volunteer folks, you typically find paid and career fire and EMS folks in larger, densely populated areas. So that was something that was kind of surprising to me and concerning also, hearing that 70%, well over, 50% of the Virginia, EMS and fire services are volunteer, and that, volunteer fire services are struggling right now.
Yeah. So let's get to how you even found this story, or how this particular matter came to your attention. How did it come to your attention? Did someone reach out to you?
Yeah, so Fire Chief Walt Bailey, who is the chief of the Phoenix Volunteer Fire Department, that's a small town in Charlotte County. He reached out to me in late January, I think it was, after another article that I wrote ran about a lack of funding and support for emergency management services in the state, on the state level. And he was like, here's this other issue that I think you should take a look at. And it, has the capability or possibility to affect like everyone in Virginia on a very granular level.
The article really starts with him in Phoenix, that tiny town in Charlotte County. And on a map, Charlotte County is below Appomattox and Campbell County. I was thinking it was further east, but it's really not. It's really part of Southside. And you kind of set the scene for us. You took us back to an ice storm earlier this winter in 2025 in Phoenix, where they got more than 100 calls between 4 a.m. and 2 p.m. on one particular day. And that was because of down power lines, road blockages. Tell us what Chief Bailey said to you about that day. Like how did they go about handling all these calls?
Yeah, so there were two people working that day in his fire department. That was him and one other volunteer firefighter. And he said that they had steadily been at it since, 4 a.m. that morning. And I had been able to connect with him at 2 p.m. that day. So that's nearly, a 10-hour day. And, these two folks at the fire department, like they're far from done, right? And he said the majority of the calls that they received were for, trees and branches in the roadways, and the equipment that they had to use was old, and like the chainsaws that they had to kind of like remove the branches from the roadways during like like morning traffic for so folks can get to work. Like the blades were dull, and I think aside from the equipment though, the main issue was that there were two folks in the department fielding over 100 calls over a 10-hour period. Um, that would exhaust me. I'm sure that would exhaust a
Right.
lot of listeners.
Yeah, and he said that, Elizabeth, you quote him as saying, the old equipment aside, we can get by with that, but this lack of personnel, what do? You can't just fabricate people. And it's when you have that many calls and a crisis, a weather crisis, and we had numerous such events this past winter, including flooding in different locations of the state. So that's the real issue there is it is a challenge with older equipment, but it's the lack of personnel, lack of volunteers. So let's compare them, volunteer force now versus even a few years ago. He said it in the article. He said something like, wind it back 5 years, you would have had this many. Wind it back maybe 10 years, you would have had this many. What's going on with the volunteer force in Virginia?
Yeah, so Bailey said that, about maybe 5 years ago, they would have had maybe 5 or 6 people in the volunteer department that day to help out. Wind the clock back about 20 years, they may have had about 15 people, which is significantly more than the 2 people that they had that day. Um, Bailey and some other folks that I talked to have all pretty much said the same thing, and that's, you know, volunteerism is down across the state. I'm sure I didn't look at across the country, but I'm going to go out on a limb here and say that it's down across the country as well. And they have the folks that I talked to kind of attributed that to a number of different reasons. One is inflation, the rising cost of living. People don't have time to work a job that doesn't pay. When they have, these bills that are increasing, they would, if they have extra time, they would probably just take on an extra job so that they can, afford the cost of living. And the cost to train folks to become certified as fire and EMS, like that has become cost prohibitive for the departments as well. So it's difficult to find volunteers who have the time and energy to support services, and then it's difficult for the departments to pay for the cost to train these folks as well. So it's kind of like a multi-pronged situation.
Yeah. Meanwhile, the volume of calls for help for fire, rescue, EMS is going up.
Yep, it's according to there. So there were a couple of different reports in recent years. One was a General Assembly legislative report that was that took place in 2023, and then another one was a report done in 2024 by VCU. I believe both reports said that the number of calls have gone up about 40% on average over I think between 2020 and 2023. So, that's 40% is a lot.
Yeah. Is any of that due to the COVID bump? Calls had to go up during COVID, right?
Yeah,
Do you know?
potentially. I would assume so. Yeah.
Yeah. Okay, so we have more calls, and we have less volunteers. I do want to get to Tazewell County because you also talked to the county administrator there, and that is where you got into some funding. How are these squads funded, and what's gone on with that recently?
Right. So the volunteer squads are funded primarily through funding from the localities. So typically taxes, so that's like property taxes, potentially sales taxes. I think it's to the tune of about like 97.15. So over or close to about 97% of funding for volunteer fire and EMS services are funded by the locality. I think there's about 1% and some change that are funded from the federal government or federal sources. And then there's about like 1% and some change that is funded from the state. So in a lot of like rural, less populated localities, you know, you don't have a whole lot of tax base. You don't have a whole lot of property tax. Like maybe there's, you know, there's a lot of like rural and farmland in smaller localities. So you don't have like the property tax base that say like Richmond or like Northern Virginia has. And so coupled with the, you know, folks who are potentially like moving out of rural towns and rural localities, so that tax base is kind of shrinking, leading localities to have a harder time paying for these services. And on top of that, like funding from the state hasn't increased, I think, for a couple of decades. So funding has remained stagnant from the state. Localities are having a hard time funding increased costs of, you know, training personnel and getting equipment. It is, you know, as Bailey said, a perfect storm
Yeah.
for, you know, yeah,
Well,
volunteer.
you just mentioned equipment. Talk about, and you might not have it off the top of your head, but I read in your reporting about like maybe it was the fire engine. The cost increase was like over 100% over just like 2 or 3 years. It was a crazy short amount of time, and it had jumped that high. What hope does a locality have, except they're still using probably an older engine, and I don't know specifics on that. But did Chief Bailey or anyone else talk to you specifically about that?
Yeah, so they mentioned that, you know, the cost of a new, I think, ladder truck has gone up significantly from maybe like $1 million to like $4 million. And if you're a small locality and you've got to fund a, you know, a number of different things with a smaller shrinking tax base, it's like, where do you get the money to buy a newer fire truck? So you just kind of, and I think potentially like the cost for those fire trucks increased due to like new technology that's being included in them, and the cost of, you know, the cost of everything has gone up over the past few years too. So inflation, new technology, it's just yeah.
Yeah. Let's talk about the lowest per capita funded localities when it comes to fire and EMS squads. You did a table in your reporting. There was an actual chart that you used, but I saw a lot of Cardinal country on that chart about some of the lowest funded places for this particular service. And people, by the way, I think one of your officials that you talked to, it may have been the Tazewell County administrator, I could be wrong, but talking about how, you get funding for police services, which is rightful, but we also think of fire and EMS and EMS as essential services, and we often think that that is a government service provided. I mean, so how is the funding so stagnant? And then tell me about the localities in particular.
Yeah, that's a good question. I think that's a question that a lot of folks in volunteer fire departments and, you know, some lawmakers who try to kind of like bring bills to support volunteer fire and EMS services are grappling with. Um, how is it that, you know, police force, they have like the newest and most expensive equipment, while you may have like a volunteer fire department and EMS service like in the same locality who's kind of like, you know, they're working with a truck that they've had maybe like since the 90s, and it's, you know, broken down a couple of different times, but they can't buy a new one because it's $4 million to buy a new one. Yeah, it's and these are all, you know, whether we think of them as government services or not, like they are government services, like, you know, on the same level as police departments. Like they, fire and EMS are there to protect and serve as well. So it's kind of strange to me that they wouldn't be funded in the same way that police are funded. But some of the An interesting thing that I found in those two different reports from the General Assembly and VCU, which is Virginia Commonwealth University, is that localities among the 10 lowest funded in the state are, and this is lowest funded in the state in relation to their population, land
Mhm.
area, and EMS call volume. And those are all concentrated in the south side and southwest regions of Virginia. So, um, yeah, a lot of cardinal country, like you said. So,
And not
those.
just, you know, far southwestern counties that are small and that, you know, often are the ones who struggle with this type of thing, with funding and other problems. But Montgomery County was in there. Um, who else do you remember off the top of your head? Scott, Lee,
Uh,
Dickinson?
Yeah, Dickinson, Wise, Russell,
Yeah,
Appomattox,
yeah,
Scott, Smith, Wise, Prince Edward, Lunenburg, Bath, City of Norton.
yeah, Bath up there. So most people, this kind of situation, unless you're in the business itself or you're a volunteer, it's not going to be on your radar until you need a service and you dial 911. What are you going to experience in one of these places? Your article talks about prolonged call times. Wanted to find that. Is that a response time or is that something different?
Yeah, so the VCU report referenced, or they used like 60 minutes as their mark to consider like prolonged call times. A couple of different folks that I spoke to cautioned me against using like that specific time
Okay.
for a number of different reasons. So I kind of just settled on prolonged call times. I think prolonged call times might, it differs from locality
Hmm.
to
Hmm.
locality and from facility to facility based on like what the patient or the person that or the building that the fire and EMS are responding to, like what the situation is. Something interesting that the Tazewell County administrator said to me, Eric Young, he said that, you know, even though their population is not like super high in some parts of the state, like there are interstates and major highway arteries where people have accidents, especially on I-81. He didn't single out I-81. I'm singling out
But you've got
I-81.
81, 77. You've got major highways.
Yeah. And, you know, those run through these localities who are experiencing these issues with like high call times. And it's something that Mr. Young said was that, you know, you don't want to be driving through an ambulance desert when you have your accident and then experience those call times, those longer call times, those prolonged call times in a life or death situation.
The term ambulance desert I had never heard of before. We're familiar now with food deserts and news deserts, of course, in our nonprofit news model. We are very familiar with that. I had never heard ambulance desert. It's ominous sounding. Is that just internal jargon? Or is that a thing that's starting to get noticed and reported on more and more?
Yeah, I mean, this was the first time I heard it too. So I don't know, maybe we're on to something. Maybe it's going to be, you know, more widely shared, just the same as food deserts and
Hmm.
news deserts.
Yeah, it's like I said, it's an ominous because you know what it means as soon as you hear it because we've coined this term now to refer to several things lacking. Um, I wonder if anyone talked to you in this story, Elizabeth, about if this affects a dispatcher's job. So if I'm in a rural area and I'm calling and I'm going to have a longer than 20, 30 minutes, which may be normal for that area because it's so scarcely populated. But if it's going to be much longer than usual because of this shortage, does dispatch, are they able to stay on the phone more? Is dispatchers are paid. Um, so I just wondered if anyone talked about how that might change a dispatcher's job at all.
So I hadn't heard that, but that is a great follow-up story idea. I think that
You're
is,
welcome.
yeah, thank you.
Don't know if there'll be anything there, but you know, I thought about the whole process. Like I said, it's not going to be on people's radar until you need the service, right? And you dial that number. I grew up in a city in Roanoke, so I mean, it's not a giant city, but it's a city, right? So I'm not accustomed to long wait times for fire and rescue because Roanoke is so much more populated than you know a Bath County or Lee County, some of these spread out places. So this General Assembly session this year came and went, and nothing happened with this matter, right? What was on the table, and like I just gave it away, nothing happened. So what were they hoping to do? Who was hoping to do something, and what were they hoping to do in terms of, mitigating this problem?
So we had two different lawmakers from our coverage area introduce this legislation to try to tackle this issue. So we had Delegate Tom Garrett, who is a Republican from Buckingham County. He introduced a bill that would have increased the assessment on certain insurance companies from 1% to 1.5%. And that additional 0.5% would have gone towards building and improving fire facilities, supporting mental health services for fire personnel, and recruitment and retention programs. So that bill never made it out of the House Appropriations Committee. Not quite sure why. I don't want to assume things.
Sure. Yeah, that's not your job. I get it.
Yeah. Another bill by Senator Tammy Mulcahy who's a Republican from Mecklenburg. She introduced legislation that would have established a state-funded grant program for localities to hire more firefighters and improve fire and EMS services. That also died in committee this year.
So Elizabeth, when Chief Bailey got a hold of you, and you've been talking to him, and then other people who have their heads in this problem and trying to figure out ways to solve it, obviously more funding would help quite a bit. Aside from that, though, and the fact that there were attempts this session to get something in the budget for it, and or some of these bills that would have potentially affected some change down the road, just didn't go anywhere. Are those lawmakers who introduced them indicating they're just going to keep trying? And in the meantime, what does Chief Bailey do? What does Chief Bailey and his counterparts across the state do?
Yeah. So lawmakers have said that they're going to, try to bring it back again next year, because without significant change, the problem's still going to be there. And Mr. Bailey, and others who work and live in the volunteer fire and EMS realm, I think they're kind of like at the end of the rope. They're seeing if volunteers, the number of people who are volunteering continues to decrease, and the cost for training new volunteers goes up, and the cost for equipment continues to go up as well. They're seeing the potential for volunteer fire department and EMS services to, they're going to start to close their doors. Like there's no.
And some of them have, to be clear. I've seen it happen in our part of the state. And what I saw was a campaign for more volunteers repeatedly, and a capital campaign, a direct mail. And then eventually they shut their doors, at least temporarily. And in case I'm wrong on any of those facts, I'm not going to name the rescue squad, but they're not alone. It was all volunteer. So Elizabeth, thank you so much for all of this, for your work on this. And I'm sure we'll see more coverage of this as we go along. And, just a reminder to our listeners and viewers and readers that give us your story ideas. This chief reached out to Elizabeth, and when we get something, we want to hear from our community about what's important in our communities. So we really appreciate that Chief Bailey reached out. And we have an email address for people who just have any kind of story idea for us, and that's news@cardinalnews.org. Elizabeth, if you'll tell us your email in case someone has a story idea or a follow-up for you, what is it?
Yeah, of course. My email address is elizabeth@cardinalnews.org, and that's Elizabeth spelled with a Z.
All right. Elizabeth Beyer, thank you so much. She covers state policy and government from Richmond for Cardinal News. Thank you so much for your time today. I want to thank our sponsor for our podcast, and that is 5 Points Creative. Also want to thank Zach Shelton for his support in our podcast as well. And just check out our paywall-free journalism anytime. It's always free, and we intend for it to always be free. It's cardinalnews.org. I'm Dutchie Jessee for Cardinal News.